Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Carina Edwards. She is the CEO of Quil. Excited
Thrilled
to
to be here. Thrilled
oh
to
my
be
gosh,
here.
thank you for stopping by. So Quil, for those of you who don't know, is the startup born from the partnership between Independence Blue Cross and Comcast NBC Universal. Did I get that in the right order? I mess up the order all the time. So I spoke with the guys who kind of put this joint venture together a bit ago, Brian Lobley from Independence Blue Cross and Don Mathis from Comcast NBC Universal, and they were like, yeah, it's a JV 50-50, but we just want this puppy to run when it gets going. So has that been true? They put you in as CEO and they've left you alone?
They have been phenomenal. So I joined as CEO 7 months ago. I literally, they are my board. They are a phenomenal board. They are very supportive, but they have literally let me come in, assess, build the product, build the vision, and dream big. And they've been a great collaborator with me.
All right, so dive in on what you've done. What have you built so far?
So we are launched. We have a patient engagement platform that's available on your phone, on the web, and also on your cable box. So we literally just launched into production the app on the cable box. So similar, there are 30 million Comcast subscribers in the world. So if you go to your voice remote and say Quil Health, the app comes up. It's about 150 health videos, wellness videos. But when you pair it with your actual phone, which is an easy one-time token, it literally gives your playlist, your care plan on the television.
On the TV. So if I go to the doctor, I can put the things to do into my Quil app and it will sync to the TV and then show it to me.
Let me break it down a little bit more. So when you're in the doctor, let's use a hip replacement. So you're going in for a hip replacement. You literally go, the doctor sees you for the 15-minute consult, tells you your surgery date's in 3 weeks, and then he prescribes or she prescribes the Quil app. It breaks down everything you need to know. It's like turn-by-turn directions of what to do next, how to prepare your home, how to prepare your site for surgery, exercises beforehand, little fun facts. Do I exercise before surgery or not? All those things. And then if you have to do those pre-surgery videos, do them right on the TV. You have to go talk to your spouse about preparing the home or even what's it going to be like afterwards, what's your mobility going to be like, how do you recover? Watch that in your living room where people meet and watch TV.
Very cool. And I'm assuming the production value of this is high. I remember Al Roker appearing to tell me about the launch of Quil and the new future of healthcare. So is he the one who's instructing us on this?
Actually, so we have a bunch of personalities, but Al is a staple. But we also use the doctors. So, for example, we're at Pilot at Penn Medicine. And so the Penn doctors, Dr. Hume and his whole team are on the video. So we cap in the content with your doctor. So when you're prescribed it, it's personalized to you. It's your doc telling you what to do next.
And I understand you already have clients.
We do. We have 2.
No, that's awesome. I mean, you're new. That's exciting. All right, so tell me about your 2 clients and what are you guys doing with them?
So at Penn Medicine, we are doing all the orthopedic journeys for them. The exciting thing for them is we launched in April. Of all of the eligible patients, 86% have opted to use the Quil app. We've been getting phenomenal telemetry from them. They've been engaging and they feel more prepared for their surgery. They feel lower anxiety. These are great proof points. The next one we announced, we're not live yet with them, but we did announce the partnership. It's on our website with Value Health and Move Health. Move is revolutionizing ambulatory surgery centers. So they're literally doing full total joint replacements outpatient in a day. And so they are prescribing Quil as their digital front door.
And I remember the guys who put this together, I remember talking to them about how really what they wanted, bottom line, was to transform the cost of care and bring that down. Like that was like number one to do on the to-do list. And it sounds like you're doing that. I do want to ask about the business model behind this stuff. So with your customers, who's paying for this stuff? Is it the patient? Is it the facility you're working with? How does it work?
It's a great question and it's evolving. So today we are B2B2C. So the provider buys it or the payer buys it and they deliver it to their patient or their member. The self-insured employer buys it as well and delivers it to their employee. In the future, longer term, we do see direct-to-consumer as an option.
Very cool.
But right now, we're really focused on, for those providers and payers that are in value-based bundles, patient engagement is key to reducing risk. And so if we can actually get patients and, more importantly, get their caregivers on the app with them, participating in their care, we can reduce that risk and lower cost.
Now, this was if I recall, Quil was supposed to be the superhighway connecting a bunch of digital services and people could get off the highway and get back on the highway and visit all of the things, at the exits. So this is one thing that you're building, is to help people kind of, figure out how to recuperate from surgery faster, right? I mean, this is one thing that you're doing. What else is on your horizon? And is this stuff I remember even too when I I talked with Brian and Don, I'd asked them, I'm like, are you going to build everything yourself, or are you guys going to start acquiring stuff? So, give me a little bit of the strategic plan moving forward. I mean, that I'm sure you've developed as CEO now.
Yeah, in my 7 months.
Yeah, right.
But yes, absolutely. So what we're doing is right now, what we've realized, the uniqueness of our platform is really the full customization capabilities of it. So it is the providers or the payers' brand, their content, their doctors, their workflows. And it's put in any workflow, but even more importantly, it's personalized for the patient. So you and I go in for the same things, but we might have different health histories.
Right.
Now, my journey is going to look different than your journey, even if it's from the same provider.
Okay.
So that's some of the technology that we own in-house, all of that decision logic, AI, and learning. As we go forward, we're not a condition. We're not just doing MSK or bariatric surgery or pivot completely. I'm actually working with a payer right now, to be announced soon, for caregivers.
Oh.
And so if you think about it, right, in the Medicaid population for long-term shared service patients, activating the caregiver and also teaching the caregiver how to deal with the anxiety, how to deal with the guilt, how to deal with the disease state that your mom, daughter, cousin, nephew is in. So we're giving them a journey.
Awesome.
So we also have some fun commercial partnerships we're working on, and all of that I think will start to evolve as we announce more.
I like this. I like how we're leveraging all of the assets.
A lot of fun.
So far, this checks out. Brian and Don did a good job setting me up for this. I love it. Awesome. Well, Carina, thank you so much for stopping by and talking with us. It's a pleasure to hear where you guys are at. Look forward to seeing what's next. The company is Quil. Keep your eye on it. And if you want to check out that video with Brian and Don, you can look for it at WTF Health on YouTube. I'm Jessica DaMassa. Thanks so much for watching. Thanks for joining us.